welcome everybody who has taken the time to attend this second seminar organized by the Coalition for Good Schools, especially the Hub for South Africa South of Sahara. My name is John Kalage. I am the Executive Director for Hakelim, and I'm also one of the co-founder members of the Coalition for Good School. Just to recap, I know there are those who are attending for the first time, and I think it's very important for me to give a brief background of this coalition. This coalition was actually convened as a result of the conversations of leaders of several organizations in the Global South on what works on prevention against violence against children in schools. Our colleagues from Raising Voice conducted an informal scanning exercise, and they had generated some preliminary findings, which gives us a perspective that there's a lot that was going on in the Global South, but much remained undocumented, and that most of what was published in peer-reviewed journal was from the North, from the Global North. And actually this made some leaders from the Global South to convene a meeting in 2019 to discuss and try to find some common position on what should be done in order to ensure that the experiences from the Global South are well understood and documented, as well as provide learning for others. So in that particular meeting, which was conducted towards the end of 2019, we agreed on the two major things. One, we thought that it is very important for us to map out what was happening on the issue of violence against children in the Global South. And secondly, we wanted also to identify who was leading on it. And third, we wanted to establish what was working, what are the basic practices from the Global South. So those are the major three things that were the outcome of that particular meeting that we had in 2019. The overall aim of this decision was to develop a platform for sharing and create a community of practice and look towards establishing an infrastructure necessary for this work to engage more fully between peers and on the global stage. So the Coalition for Good School commissioned an evidence review, which was titled The Prevention of Violence Against Children in and Through Schools in the Global South, which was authored by our co-founders, Shanaz Matthew from Children Institute at the University of Cape Town and Pranita from ICRW, to address the goal number one, the item number one, that we wanted to generate those evidence which are not very much documented. So that review identified 5 different types of effective interventions, which we will discuss today. Looking at examples and experiences from the South Africa South of Sahara and how they link it to efforts elsewhere in the Global South. And this second seminar series of webinar and the work of Coalitions for Good School addresses the second item that we identified in that meeting in December 2019. I would like now to introduce my colleague, Sohini Bhattacharya, who is the Executive Director for Breakthrough India, and a co-founder of the Coalition for Good Schools. And again, also she's like my counterpart. While I'm coordinating the work of Good School in Africa South of Sahara, she does the same in Asia region. Let me, you can put the slide up, but I'll try to summarize as much as I can her biography, but if you want to know more about her, you can actually go through the website. Sohini became the Breakthrough's second president and CEO in July 2017. She brings to her new role not only deep knowledge of breakthrough issues, areas of fundraising and landscape, but also sincerely dedication on the organization, its unique impact and its boundless growth potentials. Sohini has worked with the Breakthrough since 2010, and most recently as a Vice President of Resource Mobilization, and has developed an impressive portfolio of support for breakthrough programs, and has managed the wide range of partnership across South Asia. Sohini has worked in the development sector for more than 30 years. Before Breakthrough, she worked with the Ashoka Innovators for the public for 10 years. Sohini also worked as an India strategy advisor for the Asia Venture Philanthropy Network from 2010 to 2013. Sohini is also a board member of DASCA and the Kolkata Sunved, which uses dance movement for recovery from trauma and violence. She is also a trustee of Read India, an organization that set up self-sustaining community library across the country, and the director of the board of ACAR Social Ventures, an organization focusing on awareness on menstrual hygiene and last mile delivery. Sohini has a master in English literature and a passion for crime fiction, cooking, handicraft, and travel. That is Sohini, who is going to be our main facilitator of this session today. Now, I would like to give her the floor for her to take us into the next part of this discussion, where we will hear from our colleagues raising voice, and then the Population Council, and in all means, no worldwide, about the efforts to prevent violence in and through schools across Sub-Saharan Africa. Sohini, you have the floor.
Thank you, John. Thanks very much for that introduction. We have a very exciting time ahead today. So as we'll be hearing from 4 really great speakers and 4 really great perspectives. But before we introduce our speakers, I'd just like to take a few minutes of your time to mention the work that we've been doing at the Coalition, from all our members, and also from the evidence review that John mentioned, which is on prevention of violence against children in and through schools in the Global South. What I'm going to talk to you right now about is a few trends that we have noticed, which have very effective influence on violence against children in schools, in bringing down violence against children in schools. We've arrived at these conclusions through a very extensive review, but also we've learned this from the work of the members of the Coalition across Global South. I'm sure none of these are going to come as very, surprises to you all, because you all work in this area. But just for the sake of today's discussion, I'm going to sum up a bit of the findings for you, so that we could focus on them when we are listening to all our panelists. Number 1, for any such intervention to be very sustainable in schools, we need to weave in an integrated approach, which involves multi-stakeholders: teachers, school leaders, adolescents themselves, administrative staff, parents, community leaders. If we invest in a very diverse stakeholder approach while keeping the learners and peers at the center, and include the development of policy and regulations and training of teachers, these key things can make the intervention sustainable. Number 2, addressing the school environment is necessary. We cannot just look at the school environment as piecemeal, We have to look at the whole school system. So programs that target, survivors, as well as perpetrators, as well as bystanders, reinforce very important supportive behaviors. So programs should not just aim to address multiple drivers, but also, teachers and parental discipline, but also address the school environment, the ecosystem that is driving or perpetuating this kind of an atmosphere in school. The third thing was that group-based programs are very, very effective. In Breakthrough's work in India with our own gender equity curriculum, Taro Ki Toli, we have seen that safe spaces where groups can have intergender conversation, they can have conversations on taboo subjects or difficult subjects, they can negotiate spaces on having very conversations around very hard and very difficult to shift norms. These can successfully influence young people's attitudes towards gender roles and healthier relationships through the creation of a shared culture. Older peers in that can also become a role model, and peer-led interventions can create opportunities to promote the leadership of young people, their voice and their agency, and promote resilience through peer support. So creating those kind of youth groups or safe spaces or culture clubs are very, very important. School staff are central to violence prevention programming. The review found that school teachers can be empowered to create safe environments. Successful programs also found that teachers can be trained through relatively short programs to enhance the school environment and to provide psychosocial support. So very, very important is to focus on the school leaders, the teachers, and everybody who's a staff in that. Different types of violence require different strategies. So the age, the gender are very, very important considerations as we design programs, So we have to keep in mind that adolescents need a combination of both safeguarding, and I will deliberately not use the word protective, I'll use safeguarding, and empowerment-oriented services to protect against increasing risk behaviors. So establishing and cultivating a better and positive intergenerational conversation or intergeneration relationship where adolescents maybe take this back to their parents, their teachers to have a conversation on this has numerous advantages, and it goes a long way in helping focus on dreams and aspirations of children and help them navigate online and other spaces which are harmful to them. And lastly, I cannot emphasize most the investment in program development, implementation, and evaluation is key. We shouldn't just give our attention to what is being implemented, but how the intervention is being implemented, because that would create learning for many other organizations, for many other, geographical areas, for many other people to actually look at the efficacy and replicate it in other environments. So those are the 6 things that we found. So today, as our speakers, each bring their own perspective, here's my request. If you can focus on some of these findings, at least 1 or 2, and mention them in your work as you present your perspectives, it will be very good for us to see whether there are gaps, whether you are agreeing with them, whether you are disagreeing with them, what is the common understanding that we can bring to table on all of that. Here are our speakers for today. A detailed bio will go up as each speaker comes on to online. We have Hope Wambi with us from Raising Voices, who will present on an evidence-backed whole school approach through the Good School Toolkit from Uganda. We have Patience Munjwari from No Means No Worldwide, and will present on knowledge, attitudes, and life skills through Empower. That has been happening in Kenya, Malawi, and Uganda, and challenging gender norms and promoting equitable relationships through Your Moment of Truth in Kenya. We will have Chichi Undi from Population Council, who will present on providing psychosocial support for children, parents, and teachers through asking and telling in Kenya and creating safe environments with the Zero Tolerance School Alliance in South Africa. At the end of the presentation, we will be very, very lucky to have Stella Ayo Odongo with us, who's the director of our Pathfounding Countries Global Partnership to End Violence Against Children, who will sum up the presentation and present her own perspective and learning around the issue. So over to our first speaker, Hope Wambi.
Thank you so much, Sohini. When you were speaking, I was nodding and really excited because I could relate to most of the things that you were mentioning. And in the interest of time, I'll ask El Sante to flash the presentation. As already introduced, my name is Hope Wambi. I work with Raising Voices. And at Raising Voices, we prevent violence against women and children. And today I'm going to share a little bit more about the Good School Toolkit, which is the methodology we use to prevent violence against children in schools. So the Good School Toolkit is just a collection of ideas and tools. Next slide. The Good School Toolkit is a collection of tools and ideas and activities that help schools create good schools and prevent violence against children in their schools. Sohini already indicated why it is very important that everybody is engaged within the school setting. That is one of the key things that the GST emphasizes, that from the onset of the implementation, we have the children, we have the teachers, the parents, and the school community taking leadership in the implementation of the Good School Toolkit, and they own the process and the change that they want to see in the in the schools. And then the GST uses schools as entry points. You agree with me that there are enormous opportunities for using schools as entry point, ranging from the fact that very many students spend a lot of time in their schools on a daily, and schools also have structures which can be used to pass on a message or to create an intervention or to intervene. But also schools have so many stakeholders who have vested interest. And schools also have a mandate to ensure safety and protection of their learners. So those and many reasons drive the GST being as a methodology that uses schools as entry point to violence against children prevention, as the ideas permeate through to the communities right from the school, and parents are also engaged. And then, like I already indicated, it's a school-led implementation, and it is implemented over a period of 18 months. It is sequenced in 6 steps of implementation. Later on, you will see in some of the lessons that much as the GST is in 6 steps, we've learned that there are schools who are running with ideas. They are not following sequentially, but again, we are seeing them realizing some changes and good things happening in their schools. And this is informing part of the lessons that we are having as Raising Voices in the implementation of the Good School Toolkit. And lastly, it's an evidence-based methodology. Raising Voices conducted a randomized controlled trial that indicated that the GST reduced physical violence perpetrated by the staff to learners by 42%, but also it increased the attachment that the students had to their schools, probably because of the good relationships that they were experiencing. And also it lowered the approval of the use of corporal punishment by 50%, which is something which we've been celebrating over time, and we are seeing come true and real in the schools where the GST is being implemented. So I want to quickly run through the GST fundamentals. These are like the DNA of the Good School Toolkit. Next slide, Elisante. One is, it was iteratively developed over a period of 6 years. And over time, we have drawn lessons which have informed the adaptations. For example, the GST started as a methodology that was implemented in the primary schools. But when we were implementing over time, we've learned that the students in higher schools or the secondary schools experience violence differently. it is manifested differently in that setting. We learned that issues like bullying are high with the older students, issues of sexual violence, and they have agency and power. The more they increase in age, the more they have the agency and power. And so that agency needs to be nurtured and directed. And as Raising Voices, those lessons supported us to adapt the Good School Toolkit to the secondary education. And now we have the Good School Toolkit for secondary. And then another lesson we drew, which influenced our adaptation, is that over time, when we were developing the Good School Toolkit, we assumed that if you create a conducive learning environment, you will see a positive shift in mental health in the schools. But over time, we have learned that, whereas we were reducing violence, we were seeing that the environment is conducing, we were still seeing issues of mental health still reflecting and cropping up in the schools. And that is what informed the mental health module that has been recently developed and infused within the Good School Toolkit to help teachers and learners, first of all, destigmatize mental health, but also help them give it language and gain the basic skills that they can learn, that they can use. And then lastly, in terms of adaptation and the lessons we have drawn, we have learned over time that we need a scalable version of the Good School Toolkit, which is not just a reductive process, but for us to have a package which is scalable, which is focusing on the most impactful activities to deepen the impact in the schools. And then another attribute is it is based on analysis of power and the human rights. The GST recognizes the fact that the abuse of power is the root cause of all forms of violence, especially against children and in all settings. And so through the activities embedded within the GST, learners, teachers, parents, and all stakeholders are encouraged to reflect on the power that they have and how they can use that power to nurture and support to bring out the best out of their peers, but especially the best out of the children that they are in support with. And then, like I already indicated, the implementation is led by teachers, students, and parents committees. From the onset, when the school decides that they want to implement the Good School Toolkit, they form the committees, and those committees mobilize their respective constituencies in their categories, and they run with the ideas of implementing the Good School Toolkit. So here you mentioned something about voice, agency, and participation. That is at the center of the Good School Toolkit. There are so many activities that provide an opportunity for students to voice out. For example, they participate in the formulation of the school policies at their classroom level. They participate in raising their concern through the suggestion boxes, the idea boxes, including discipline, where we have a student's court suggested as one of the activities, and also their presence of the committee so that they can exercise their agency and voice on the matters that directly affect them as students in a school setting. And then the main aim for the Good School Toolkit implementation is to address an operational culture. Violence thrives in spaces where it is accepted. And you agree with me that you will not address an operational culture in an ad hoc manner. So we are trying to encourage, there are activities within the Good School Toolkit where schools are encouraged to have aspirations, to have standards and values, and also break down the policies which govern the practices in their environment. And those policies are all pointing towards having a non-violent community. So when they come together and come up with these values and standards and policies, they tend to have to influence the operational culture, and they take a stand on saying no to all forms of violence against children and work towards their aspiration over a period of 18 months. The GST also recognizes that violence is not an incident, that it's not a one-off that I'll go and say stop corporal punishment and that is it. It is long-term. It takes a lot of it is a process. It has long-term impact. A child carries with them throughout their lifetime. So it is important that we expand the concept of violence beyond just an incident so that we address the operational culture, which the GST tries to do. And then lastly, the GST addresses critical relationships that contribute to the student's experience of school. But because we are saying violence is not an incident, so we shall not say we are stopping corporal punishment or we are stopping sexual violence, but we are saying we want, or the GST wants this child to experience school in a certain way. And the experience that a child has at school is really determined by the different critical relationships within. So the GST looks at addressing the peer-to-peer relationships, addressing the teacher-to-student relationships, but also how does the community or the parents relate with the school. If we have those relationships catered for, then they will contribute towards putting into place a conducive environment for all the children to thrive and prevent all forms of violence against children in school. So briefly, those are the fundamentals of the Good School Toolkit. That is the DNA of the GST in preventing violence against children in all the schools. Thank you so much. Back to you, Sohini.
Thank you. You know, what is that one interaction that the child is having in school that is fundamentally changing his or her perception about violence, life, everything? Well, that's so wonderfully, articulated, Hope. May I call our next panelist, who's Patience from No Means No Worldwide. Patience, over to you now.
Thank you and good afternoon to everyone, or good morning, depending on where you are tuning in from. So I just want to thank the Coalition for Good Schools for inviting No Means No Worldwide to come in and present on our intervention, which is called the No Means No intervention. So I'm delighted to be here, and I look forward to having very interesting discussions with you all. So if you could go to my presentation, please. Sorry, El Sante, if you could share my presentation. Okay, so while he is going to the first page of the presentation, I am really going to be talking about the No Means No intervention. And this is an evidence-based child sexual abuse prevention intervention. And if you could go to the next slide, please. So, so the No Means No intervention is a dual gender program. So we are targeting both boys and girls. So these are children between the ages of 10 and 20. As you will see from my presentation, our intervention is a group-based intervention, and it is very targeted on a particular form of violence. So our intervention is about rape prevention, and we teach it in group settings, in classroom settings, where we hope that through working in groups, children are going to be encouraged to develop positive attitudes towards ending gender-based violence. So if you have read the evidence review, you will see that our intervention is referred to as Empower for girls and Sources of Strength for boys, but we now simply refer to it as the No Means No program for girls or the No Means No program for boys, and that's how I'm going to be referring to it in this presentation. But really, I am talking about Empower and the Sources of Strength as in the evidence review. So when we so how we teach the intervention, we teach it through a series of classes between 8 and 12 hours of classes for both the boys and the girls. But for the girls, we are teaching them verbal, mental, and physical skills that are based on empowerment, on an empowerment self-defense model. So some of the skills that we are teaching them include, self-efficacy, the idea that they are worth defending, the idea that they are worth protecting, the idea that they themselves can take action to ensure that they are protected. We are also teaching them empowerment. We teach them also assertiveness. This includes boundary setting. It also includes being able to use your voice and to assertively say no. We also talk a lot around the role of the voice and also the use of physical self-defense. So we are teaching them skills to defend themselves. And then for the boys, we focus more specifically on awareness raising, knowledge building, as well as behavior and attitude change. We are focusing on the promotion of healthy masculinities. And so some of the lessons include awareness, personal safety, positive masculinity, redefining gender norms, debunking rape myths and culture, as always, and also disrupting the cycle of force and getting consent, and what could bystanders do in a situation of violence, so bystander intervention. So that in a nutshell is our program. If we could go to the next slide, please. So really the efficacy of our intervention is measured through the findings of various researches that have been conducted on our program. And on this particular slide, I am going to be referring to findings of studies that were done by Stanford and Johns Hopkins University between 2009 and 2015. And these were done in Kenya and Malawi, which are the ones that are referred to in the evidence review. So if we look at the findings of those studies, they showed that about 42% of the female participants in our program had used the No Means No skills to stop a sexual assault in the year following the training. It also showed, for example, that 79% of the boys who witnessed physical or sexual assaultive behavior had successfully intervened to stop it. And about a 46% decrease in teenage pregnancy-related school dropouts was also visible amongst the participants of our program, and about 47% decrease in the overall incidence of rape among female participants of the program. So those are some of the key findings. And if we go to the next slide, so if we can go to the next slide, please. So this slide is showing results that came out of our most recent annual program review. So this is our program review for 2021, and it showed that when we look at changes or shifts in knowledge and attitude, that No Means No graduates showed an average of 62% improvement in understanding their rights and knowing how to prevent sexual violence, as well as demonstrating positive attitudes towards gender equality. So those are some of the results that we have encountered as we have implemented our program. So we value the learning that comes from the research initiatives that we conduct, as well as the continuous monitoring and evaluations of our programs that are conducted by our MIL teams, and also the learnings that we learn from our partners as they implement the program. If we could go to the next slide, please. So in terms of our monitoring, evaluation, and learning, how are we collecting the data that we are presenting as showing evidence of the success of our program? So we have MIL packages that are designed to monitor key program outputs and indicators, as well as us conducting evaluations or short-term evaluations of our program outcomes. We've also conducted a number of qualitative and quantitative researches. These include randomized control studies that have been undertaken by various research institutions on our program to measure its effectiveness, as well as in some of the countries that we have worked in, we have also done technical program quality assessments to look at how the program itself is performing. And what have we learned? If we go to my almost last slide. So what have we learned as No Means No worldwide? So we've learned that our participants, the young boys and girls that are participating in our programs, gain self-efficacy. They also demonstrate knowledge and also are equipped with skills through the No Means No program, which they have used to prevent sexual violence. We have also learned from our evaluations that legal, medical, and psychosocial support services and referral networks for survivors of sexual violence must be strengthened. In almost all the countries that we have worked in, we have found that survivors of violence struggle to access the right kind of services that they need post a traumatic event. And then we have also learned that, scaling of our program is very possible. In the review, in the evidence review that was done by the coalition, I think they focused on three countries that we work in. We work in more than 3 countries in Africa. Currently, we are working in 8 countries, and we have been working with partners in those countries to scale up our program. And what we have learned as we have scaled the program is that it is important for us to do a great balancing act between balancing the fidelity of the program. Our program is evidence-based, and so we would want to keep the key tenets of the program intact. And also at the same time that we need to be flexible to take into account specific contextual issues that are unique from country to country or from region to region within a country. So that balancing act is very important. So curriculum and program design and contextualization are very key to the success of our program, but also they are very key to for the program itself to be sustainable. So we've seen that as our partners are able to contextualize the program to suit their context, it is likely to be received much better by the learners who are the beneficiaries of the program, but also our partners then are able to own the program much more when they have been able to contextualize it to suit their own contexts. We've also learned quite a bit in the COVID era. So we had to contextualize our curriculum as well to suit the COVID context. So for example, some of the skills that we were teaching previous to COVID were contact skills that required much greater contact. And we, for example, had to contextualize these to come up with a COVID safe curriculum. And this, helped us to continue to reach young people with life-saving knowledge and skills that they need to prevent sexual violence. But successful adaptation of the No Means No curriculum for COVID safety was one of the opportunities that we learned during the COVID era. So, so those are some of the things that we have learned as we have rolled out our program amongst youth in the different countries that we work in on the African continent. And I think this is a good place for me to stop for now, and then I could always come in again as we have a much deeper discussion. Thank you so much.
Thank you, Patience. That was just fantastic. It was so so heartening to learn that you can actually, bring some change in sexual abuse by working with children in school. And as you said, contextualization is key, so how you take into account communities and different geographies. That's such a fantastic, insight, and to add to our kitty of insights. Yeah, thank you so much. So as we now go on to our next speaker, Chi from Population Council, who's going to talk about psychosocial support for children, parents, and teachers. Chi, welcome to the panel. And while you are talking about it, may I just, because you come from Pop Council, adolescents are a big area of expertise for you. While you are presenting your perspective, may I also ask you to just dwell a little bit also on what can we do to bring all these learnings together? What can we do to better collaborate and collectively advocate for these effective approaches and models? Yeah, over to you, Chi. Thank you.
Thank you very much, and hello everyone. I am delighted to be here to talk about this intervention, and I'm doing so not just on behalf of the Population Council, but on behalf of the Gender-Based Violence Recovery Center of Kenyatta National Hospital in Kenya. We've been long-term partners in really a lot of work, including this particular screening intervention, which we're calling Asking and Telling, quote unquote. Specifically, I'd like to acknowledge Dr. Margaret Makanyengo, who is a consultant psychiatrist. She was the inaugural head of the Gender-Based Violence Recovery Center at Kenyatta National Hospital, and all of this work has been done in close collaboration with her. Next slide, please. So just a little bit about what the problem is that we were trying to address. On the right-hand side of the screen, you'll probably be familiar with these reports, which are the reports of violence against children surveys in the East African region. And of course, these surveys have been done in around 23 countries across the world. And I think even before the violence against children surveys began, those of us working in this area, we already noticed in our programs that there really was a high prevalence of children who had been exposed to different kinds of violence, including sexual violence. So it was really a relief to have these surveys say something very definitive about the magnitude of the problem. What these surveys also tell us in the region is that sexual violence against children oftentimes occurs in their lives for the first time in school. When it does, children rarely tell anyone about it, and therefore few of them end up receiving any care, even though many of them would like help for it. And so the question is, if children aren't necessarily telling us this, can we be a bit more proactive by asking? And so that's what this intervention is about. Next slide, please. So if I were asked to be simplistic about what this intervention is about, I would say it's sort of a multi-level dialogue. Of course, it's more than that, but a lot of what you'll see on this slide really has to do with dialogue. So screening for children, we've done this as the Population Council in partnership with Kenyatta National Hospital. We've done this for women very successfully with good results. And so the idea was, why don't we adapt what we've been doing to the needs of children? Although it's not as uncomplicated as it sounds, this sort of adaptation process. So we needed to come up with a screening tool that was child-friendly and that could really elicit children's experiences, in a really safe way. And so that involves everything that you see here on this screen. I'll start from the right-hand side. First of all, the student sensitization sessions. These are sessions that Kenyatta National Hospital was already doing with children. So as a form of sort of community partnership, they were going out to schools and talking to children about sexual violence, telling them what sexual abuse looks like, and so on and so forth. And these were just sensitization sessions. And then they started asking children, they would pass around a bag and say, just put in an answer. If you've ever experienced anything like this, write yes or write no and put it in. And then they would go back and find that about at least 60% of the children were saying yes. And finally, there was a time that after they had their sensitization sessions, they were packing up to leave and they were actually leaving, and then 10 children ran after them to say, I've experienced this. And they realized, oh, well, we've been sensitizing, but we didn't really think about what the response should be. And at that point, we said, well, we have something here. This is an area in which we can intervene. So let's build on these student dialogues. Let us bring in parents as well. Let's have these dialogues continually led by Kenyatta National Hospital psychologists. And let's have them indicate that, you know, after these talks that we're having during school assemblies, we're going to be available. We'll be here at the school, seated for the whole day, just in case you have anything to tell us. And let's also tell them about a possible screening intervention. But of course, we could not screen children without having the permission and buy-in of parents. So a key element was further dialogue, this time dialogue with parents specifically. These dialogues were convened by the primary schools themselves. And so we had the school personnel involved. We had parents of children in grades 6 through 8 being invited for these dialogues. We had chiefs from the community and other key community stakeholders coming in to attend these one-day dialogues for parents to just, they were facilitated dialogues, facilitated by Kenyatta National Hospital, about the issue of sexual violence and their children and what they were concerned about, what they were seeing in their communities, what they thought the solutions might be, and whether they thought that screening might be something that they would be interested in, since there were obvious, you know, parent-child communication issues around talking about sexuality-related issues, even if it were sexual violence. And through those dialogues, we were able to sort of break the ice and have parents start talking about these issues. Teachers were really instrumental in these dialogues. They worked with children to prepare skits based on sexual violence and what children were seeing in their communities. Those skits were used to introduce the dialogues and get the conversation going. And in the end, a large proportion of parents were very interested in having their children screened and in allowing us to provide psychosocial support to children who are identified as experiencing violence. In addition, parents who heard about the dialogues were inviting their friends for the dialogues, even if their friends' children didn't go to the schools, but you know, there was just such a need for this within the communities. And so dialoguing kept happening in that way. We of course had to ensure that providers were prepared to respond to children who experienced sexual violence, and not just children, but their parents as well, who tended to be traumatized, of course, when they found out their children were experiencing sexual violence and they had not been aware of it. And without this intervention, they never would have known. And so that involved some training for providers. This training was carried out by the Regional Psychosocial Support Initiative, drawing on a model that they developed and have continued to use, referred to as the Tree of Life. So the providers were prepared to receive children at Kenyatta National Hospital if need be. And for those cases that were not acute, which was the majority of them, providers were prepared to provide counseling to children that had experienced some sort of sexual violence, and their parents who would come in as well for counseling at the schools. So this counseling did occur, and you'll agree with me that counseling in itself is dialogue as well. And so through counseling, children were able to disclose, and we're also able to, you know, talk with counselors about possible solutions. Disclosure was not always easy for children, and for many that did disclose, they were not necessarily ready for their parents to be involved or to know about it. So it took extra dialogues with parents to, you know, help parents communicate with their children and help their children understand that they were there to help and not to punish, and that, you know, experiencing sexual violence did not mean that it was your fault. There were also warm referrals for, so parents oftentimes were busy and could not take time off work because of the nature of their work in these communities, and would have to, you know, and so gave permission to the team to actually accompany their children to the nearby Kenyatta National Hospital to receive comprehensive care in acute cases, such as cases of actual rape. And we know sexual violence goes beyond just that. Next slide, please. So I just want to talk a little bit about the connections of this work with the actual evidence review. Next slide. For the actual results, I will paste the reports in the chat, just in case you want to read up a bit more about how effective the intervention was. I do want to agree with the findings of the review. want to talk about group-based intervention, here's one of the parent dialogues, the very first one that we actually convened within the schools. And you'll see that the hall is packed, and we had all kinds of parents coming in, and we were able to engage with them as a group to create this group sort of understanding and, you know, a level of outrage really about sexual violence occurring in their communities and the fact that this could actually be happening with their children. So I do want to agree that, you know, this sort of approach can really help develop shared values, in addition to the group-based approach of talking to children as a group during assemblies. Next slide. Next slide, please. I think the previous one maybe. Was the slide skipped? Yes, I also want to just mention that the development of these interventions is an iterative and learning process. So we learned along the way and made the intervention stronger along the way. In the previous picture that we showed, you'll see the hall was mainly full of women. In this picture, you see that it's primarily men. What we found was that when we called for these dialogues, it was the mothers that came and not the fathers. And yet when the screening began, children oftentimes weren't really willing to receive services in the care of their mothers. And so we realized we need to do something to bring fathers in. What brings men together? And in this particular context, it was really what we call a goat eating. Bring a goat, get it roasted, have men come together and talk about different men, you know, related issues. And so we bought a goat for each of the schools and had it roasted and called a Father's Only Day, really a Father's Day, for men to come together and talk about important issues. And you can see that the hall is full. You know, a lot of the dads began to show up and talk about this issue. And so we had a larger pool of stakeholders who were outraged about, you know, this problem. And so we learned that, you know, we had to tweak things along the way. Although this was only meant to be a screening intervention, over time, children would come to us and say, the boys would come and say, we want a session just for us. We'd like to talk about sexuality issues. And so the psychologists, in addition to screening, would use their spare time to have sort of ad hoc sessions with boys to talk about relationships and sexuality and so on and so forth. And so those are the things that we continued to incorporate. Next slide. I think my time is probably up. Next slide. Next slide. Since my time is probably up, next slide. I will just dwell on this last slide, that teachers can be trained and empowered to improve learner behavior. Teachers were really instrumental in this intervention. Here's a picture of one of the plays that the children did to sort of break the ice as a conversation starter for one of our parent dialogues. And we had the drama teachers in each of the schools work with the children to come up with their own skit. The parents were delighted by that, but also really touched that children acted out things that they themselves were seeing or experiencing within the communities. And the teachers were also really helpful in ensuring that we had an organized approach to screening the children whose parents had given us permission. And in even bringing in children who were not in our sampling frame to say, I think you really need to talk to this child. I think they're experiencing something. I will say though that for this particular intervention, teachers did feel, and it could be because we were working in low resource settings, teachers did feel that sometimes they were actually overstretched, and that even though they had guidance and counseling teachers, they had so many other responsibilities that it was such a great relief to have psychologists, you know, actually focus on doing this piece of psychosocial support work. So I just did want to point that out, and that parents from the formative study we did before this study began, before the intervention began, parents, school personnel, they really didn't feel that teachers were necessarily best placed for screening, but that doesn't mean that teachers did not play a really pivotal role in the overall intervention process. I'm going to end there because I was only given 7 minutes, and say thank you to you all for your attention.
Thank you, Chichi. That was immensely, you know, helpful and interesting. And that point about fathers, you know, in our work in India, we've also often seen that when we talk about delaying age of marriage, you know, fathers, since they're many a times decision makers, if we talk to them directly, you know, things happen and they listen. Yeah. So thank you very much for that. We now have Stella, Stella, will you come to the panel? And Stella's going to actually talk about, reflect a little bit on the panelists' presentation and connect them to the key findings of the report that we spoke about right in the beginning, and any other reflections that you might have, Stella. For everyone, Stella is the director for the Pathfinding Countries under the Global Partnership to End Violence Against Children, and you can read her bio on the slide. And over to you, Stella. Thank you so much.
Thank you very much, Sohini, and thank you to all the panelists for amazingly giving us the expose of the different works that they're doing and different interventions and the successes, challenges, and opportunities that we can learn from. As at the Global Partnership to End Violence Against Children, we associate ourselves with the coalition and really are happy to be part of this initiative, because ours is about practices that have been tried, tested, and we need to scale them out. And I just want to put that out there that we will be very interested in following this up. In terms of the key successes that are picked from the presentations, I think what the thread that cuts across all the three presentations is the component of multi-stakeholder, multi-sectoral interventions and investments that are resulting into changes and realizing and causing, being very sustainable in the programming that we see. An example that Raising Voices shared is how they were targeting the schools as an entry point was very critical. And then the last presentation, also by the Population Council, did touch on how these multi-stakeholder engagements was very important, bringing the parents on board, bringing the teachers, bringing the children, and ensuring that the children are at the center, ensuring that the teachers are very involved. In many cases, like you mentioned, like was mentioned in the last presentation, teachers tend to be misunderstood or left out. But in this case, we saw an integrated approach. So multi-component interventions focusing on engaging multi-stakeholders is very critical. A second point that also came out across the three presentations is that addressing values, policies, and practice, targeting the whole school environment is more effective in reducing violence. We saw the percentages that was shared by No Means No. 46% that used No Means No they had decreased teenage pregnancy, they decreased rape by 47%. But one thing that also stood out for me was the fact that even in the emerging situations such as COVID, the No Means No was very instrumental to be adapted as a means of mitigating the situation around the COVID, especially when we saw schools being closed, the home now being the center where all the violence was taking place, online presence increasing. So that was quite interesting to pick up from there. A third aspect that I also picked, which I think resonates with what you said at the beginning, is group-based interventions can help develop shared values, operational culture, and successfully shift gender norms. Again, this we saw in the No Means No, where they work a lot with groups. We also saw in the intervention by the Population Council, the very successful way of working with children, working with parents, and ensuring that this actually causes a shift between young people. Raising Voices did share in the Good School Kit on the role of teachers and how the empowerment of teachers can improve learner behavior, that interaction between the teacher and the students, and focusing on one vision of ending violence in schools was came out very clear. And what I also liked is the fact that it did actually, through the Good School Toolkit, we're able to see the agency of children come out. We saw the participation. We saw them participating participating in this, in the formulation of school policies. At my time when I grew up, when I went to school, it was unheard of for a child to even have a say in any school policy. What would you be doing talking about a school policy? And it was even taboo to talk about things that have happened to you. And I think no means no is also a way of empowering the children, that you see you can be able to speak out to some of this, you can be able to push back. And I think building the agency of children across the three presentations came out quite clearly. Targeted intervention is needed to address specific forms of violence against children. I mean, this came out very, very strongly through the three presentations. But I just want to hone on to the presentation that was made by the Population Council. It was indeed very, very targeted. It started as a screening or sensitization approach, and going into the schools and speaking to children. And then thereafter, it is snowballed into the realization that you see, we cannot just come in, speak, and then go out. The children themselves, it created a demand. The sensitization then created a demand, and then the demand then resulted into another program, dropping in other stakeholders, bringing in the parents, and then realizing that only mothers were coming on board. Then it also caused them to think, okay, I think we need to bring in the fathers. And one thing is also the creativity. I like the goat roasting. I mean, this is with due respect to the men on the program. I don't think it's about the men loving meat, but I think that was an attraction that caused them to come to the show, because there was something different that was bringing people together. Maybe gathering in Uganda, the culture of gathering around a pot of a drink where you're all sharing is the creativity. So that innovation is what we see, what actually caused the program probably to thrive. Now, all of you've talked, all the three presentations touched on the need that development of that successful interventions is not an event, it's an interactive process and a learning process. It happens over time, and we can talk about all the examples with the Good School Toolkit. Started in the primary, with targeting primary schools. Finally, it was seen that it could actually be adopted and scaled up to the secondary school. The No Means No program that started with the group of children, and now the realization that it can be scaled up and and be contextualized in different contexts. All these are characteristics of the programs that we have seen, that I've picked from your presentation. I just want to end with some quick takeaways for us. I think we started by saying the focus is when John, I think John or Peter was giving his opening remarks, I forget the name, forgive me. He talked about the programs, that there was limited programs being developed in the Global South. And I think this is an example of what has worked. And these programs were developed in Global South and can be adapted, especially and scaled out, and it will actually show better results. The second thing that has come out for me as a lesson, and I think that I also want to put out there, is that the need to build partnerships with practitioners. It's coming out clearly that it's important for us to take implementation to scale, for us to take all the programs to scale. There's need of the link between the practitioners and the implementers and the programmers to be able to bring programs to scale, because uptake of these important findings will be critical once we work with the group. And needless to say, and this is because my time is out, the urgent need for investment to adapt the promising practices. These are very, very excellent practices. I know that the Good School Toolkit is already being promoted to scale. I know No Means No is being promoted to scale. I know that the psychosocial support for children and parents is also being promoted to scale, but I think we can do a lot more. What lacks in our midst, and what I think is something that is limited in what we do in the Global South, is the issue of documentation. That we have a lot of good work, a lot of good practices that are promising, but a number of them have not been tested, have not been documented. And if we can document these programs and put them out for implementation, that would be be really, really good. I had only 5 minutes. I hope I've not overshot my time. In case there's anything else, I'll come back over. Thank you.
Thank you, Stella. That was fantastic. And I think one of the points that I also felt while listening to all the panelists, and I think Deepak has mentioned it in the chat as well, is how that significant adult in the child's life, how the relationship between the two is always shifting, and how there is then a shifting of power, because generally adults have much more power than young children. How that shifting and sharing of power actually changes the dynamics. There's a lesson in many of us as we lead organizations and we lead programs to look into that. So thank you for that. I have some questions for the panelists, and I'll start with one of the questions that has been addressed to everybody. And I didn't hear a lot about that, so I'll start with that. Can anybody say more about efforts to engage ministry stakeholders and local education officials? Are these interventions possible without these actors supporting implementation? Would anybody like to take that? Who would like to take that? Hope?
Yes, I will gladly take that.
Great.
Okay, thankfully, that's also my role. But from the development of the Good School Toolkit, actually, we had an advisory body that was working to develop it. And this constituted students, parents, it had teachers, and it also had school administrators and the Ministry of Education and Sports. So they've been involved right from the development of the Good School Toolkit, and even the current adaptations, the most recent that we did with the secondary school, they are so much involved. They are still part of the, the iterative development of the materials. And beyond that, we've been having conversations, especially about scale. Someone talked about scale, and we know that Raising Voices is just a small organization, but we don't have the structure and the resources to scale up this across the country. But we have examples where, for example, we worked with the Ministry of Education and when COVID came in, we were in meetings and they were saying it's very important that we try to address the issue of violence now more than ever. And they said, Raising Voices, can you make sure that we scale this to many more schools? And we worked together to have a package of 5,000 materials which were distributed to the schools, again, using the structures of the ministry, like where I don't go as Raising Voices everywhere, but we have the district education officers and other structures running with the implementation. So we only offer the virtual support to the schools and also the district level in these stakeholders. But also beyond that, we Raising Voices sits on different working groups within the Ministry of Education and Ministry of Gender to kind of influence the conversations that go on around violence against children. And the toolkit has been recognized and acknowledged in different spaces by the ministry as a good methodology that is worth scaling up and that is worth taking to all the schools. And it has been certified by the National Curriculum Development Center of Uganda, of the Ministry of Education, as a methodology that can be taken to all the schools. So efforts are underway to see that we can take them to as many schools as possible in partnership with the Ministry of Education. Of course, there are challenges, but those are things that we can always maneuver when we work together. Thank you so much.
Thank you. Somebody had a question on that, on the Ministry of Education's position on this. So hopefully that has also been answered. Let me go to the next question, and I hope somebody else can take this. How do you balance the experience of preventing VAC at schools with preventing VAC at home? Because most researchers show that VAC incidences are also done by close relatives at home. So how do you really work on that? Who would like to take that? Anybody from the panelists? Like Chichi? Great.
You can go ahead, sure. Well, I think I might have answered the question online, but interestingly, these conversations began in school, and one unintended consequence, a positive one, was that the school conversations began to trickle down into the community. Tracking what was happening in the community was sort of beyond our remit, but because we were collecting data with children and parents who lived in the communities, we found all kinds of instances of change happening within the community, because these parents, who we were bringing to the schools came from those communities. And so they started working together. And remember, we incorporated sort of local administration into the dialogues as well. And so they started working together to start their own sort of community action. And so it was no longer acceptable, because we brought them together as a group, and there was this group understanding that this should make us uncomfortable. We should be outraged about this. And so outside the walls of the school, what we found is that the conversations sort of continued. So I think that that's something that could happen, that even if you don't have the resources to do something everywhere, if you do it well where you are, it sort of begins to take on a life of its own.
Yeah, and a kind of a ripple effect also. Yeah, thank you. The next question is for Patience. Can no means no approaches be scaled up in other countries? And if yes, what would be the starting point?
Thank you for that. So we are working in about 11 countries at the moment. So yes, they can be scaled up to other countries. So we have found that each country is different in terms of the laws that govern it, in terms of the context of violence that it is operating in terms of the services that are available for survivors of violence, and also even, the way schools are administered and so forth. So there are a lot of contextual differences, but for scale up to be successful, we need to take into consideration these contextual differences and allow our partners to be able to contextualize together with us the curriculum in ways that work for them, in ways that allow them to operate within the policy and legal framework of the countries that they are operating in. So as no means no, what we do is we train instructors in the countries who are then going to be the ones who are going to deliver the program to the youths in schools. So we try to work with young people, young people usually young people who have come out of the school system themselves, who are likely to be able to speak in a language that the young kids understand. And so that has also helped us in terms of being able to implement the program. But we have learned that us as no means no cannot sufficiently go into every country and implement the program ourselves. So we work through partners. Our partners are the ones who have the instructors that we train, and they are the ones who are involved in the rollout of the program.
Thank you. Thank you so much. Our next question is to all the panelists, whoever wants to do it. How do you inspire teachers to take up these interventions? How do they balance this with their regular school calendar, especially, making up lost time after school closures now with COVID, and otherwise also teachers are called upon to do so many things. How do you inspire them to take this on? Who would like to answer that?
Okay, I'll go first. I hear you when you say that schools lost a lot during COVID, but you agree with me that now more than ever before, do we need to create safe space Sorry, we.
Sorry. Yeah, yeah. Can you repeat what you were saying?
Yes.
Sure, sorry, yeah.
I was saying now more than ever before, we need to prevent violence against children in schools and in communities and homes and everywhere because of what we've all been through. And the beauty about the methodology that we are using is that it doesn't require extra. You know, the activities can be infused within the daily curriculum. If I'm having a staff meeting, I can choose to discuss violence against children. If I'm meeting the learners, I can choose on a daily, if we are developing these policies, if learners are being at the center and they are participating, it is fun. But also at the end of it all, the benefits that come from the implementation are something that schools also would desire to have. So I know that we've had these challenges. There was a time when we had the ministry speaking about the need to scale down on co-curricula, but then we realized that actually there was need to increase on the co-curricula because some of these are considered as co-curricular activities as opposed to pumping the children with academics because they had already been through a lot. So it doesn't require a lot of resources. It's just commitment and time, and then the benefits that come from it are enormous, and teachers are motivated to do the implementation. Yeah.
Thank you. Anybody, anything else to add to that from any of the panelists? Anything different or anything interesting? Yes, Patience?
On our end, we have found that most educators agree that gender-based violence is a very serious problem, and it is a problem that they are grappling with within the school environment, as well as learners who have been subjected to violence at home. And so we have found that they are very open to including an intervention that actually helps young people prevent violence. We have also realized in some countries that some of the elements of our curriculum are things that are also in the school program with regards to life skills and life orientation programs or comprehensive sexuality education programs. And so they are very happy to incorporate the No Means No program in that regard. And what we've also seen in some cases is that schools are willing to provide time. So where schools, for example, finish at 1, they are happy to finish at 2, so that they give us an hour to do our programming because of this acknowledgement of the dire need of knowledge that young people have to address issues of gender-based violence.
Thank you. Thank you so much to everyone, all the panelists, for such fantastic insights. I just wish we could pack all of this up and go to each country in the global south and say, here it is, go ahead and do it in your schools. Thank you so much. Over to my friend John now to sum up today's conversation. Thank you, everyone.
Many thanks, Sohini, for excellent facilitations. Before I thank the speakers and also Stella for a very good analysis of what has been presented, I just want to re-emphasize on 2 things. I think it is very important for these practitioners and their experience to inform policies and be in charge of investment decisions about how to invest, how to prevent violence against children in the global south. And also, since most of these children go to school in the global south, I believe the voices, I believe the experience, I believe the knowledge from global south is crucial in order to ensure that schools are a safe place for children to be in order to enjoy their education right. Now, let me repeat it to give my sincere appreciation to the 3 speakers for a well presentation that you have done in a couple of minutes. You were very able to summarize your interventions in a very short minutes to the extent that we really got something to take away with us. But I also want to thank you, Stella. Stella, your summary was super. You really summarized it very well. The experience that came from each of the speakers. So thank you very much for that. that good summary. Now we are having another seminar series on 13th of July, and I want to extend our warm welcome to everybody who has attended this one to join us in the last seminar of this series of webinars. There's a lot that we need to discuss during that, and that will conclude the 3 questions that engage our mind in terms of gathering the information, in terms of understanding who is the practitioners and what works. So in the next webinar, we'll be focusing now on what works in order for us to have some takeaways from those experiences and see where we can learn and implement in our areas, taking into consideration our respective contexts. Otherwise, I thank you everybody who also attended, and I thank you once again all those who participated in this seminar. All the best. See you on 13th of July.